Good morning,
Good morning.
Good morning, Mike. Thank you so much.
Beth.
John, thank you for getting us started.
Sure. Yep.
And will you be able to share the screen, Mike? You have slides?
Oh, absolutely, I do.
Okay, great.
Oh,
And I
yeah.
think Marnie's going to join us, but you're doing the main presentation, correct?
Say again, was that for me?
Yeah, Mike, I think you're doing the main presentation, but Marnie is joining us.
No, I've mentioned to you, Marnie is not available. I'm it.
You're
Oh,
it.
okay, got it. All right. Oh,
It makes it easier to switch back and forth, but no, she's actually at another meeting in Colorado, and she said, Mike, can you cover this? And I said, well, I can't be Dr. Marnie, but I can do the other stuff. So
very
So
good.
Beth, I'm going to go ahead and make you the host. All right.
Okay.
perfect.
So in case, and you're already a co-host, Mike.
Okay. Oh, good. Thank you.
Well, we've got Marnie here, so I'll just introduce her as well as one of the coordinators, and then I'll turn it over to you, Mike.
All right.
There you go.
Marnie, you are here.
I am.
Well, did we cross our wires because you said you were not available, so I said I'd be happy to cover
No, I appreciate it because I was gone to my med school class 50th reunion and just got back late last night.
Wow.
it. All right. Well, I designed the information we're sharing with you, and in fact, Marnie, what I've done just to let you and everyone else know that we are Marnie and I are End Polio Now coordinators and leaders for zones 26, 27. I'm stealing your invite or your intro for us, but I know the clock is running. I only mention that, Marnie, because I was able to transcribe and pull out some of the information that came from Mike McGovern. Okay.
Yep.
And so I what I'm trying to do right now, by the way, is then go to the public image people and see if I actually have time on Thursday to share it. And Beth knows what that is. This is our monthly meeting. And of course, we picked October 24th to do this. And so the whole world is celebrating along with us. So you have, I think you've seen many of these, but some of these you'll recognize too, Marnie, and you might want to, when you see it, if you just want to jump in, we'll have my deck up and you can jump in and chat anytime. Would that work?
Sure.
Great, good.
Okay, well, I will introduce both of you and then we're going to save questions for the very end so that you have the 20 minutes to present and then there'll be a Q&A after that. And then this ends promptly at 8 o'clock. And it will be recorded.
Good, thank you.
Okay, and thank you both. And thank you, past District Governor Don.
Sure.
Really appreciate it. Yeah, this is something new for our district this year, is doing chat with the experts on a variety of topics. So we're excited about it.
Oh, that's terrific. Well, happy to
We're
help
also
you out.
competing with Stephanie Urchek this morning because she's visiting our district and has a Q&A this morning at one of our clubs. So
my
that's why
gosh.
Diane's not here.
And she was celebrated also at the one of our district's 100th anniversary yesterday. So
Yep.
she was there for that. So
Yep.
yeah, lots going on in our district.
And in the world, she will be on a live broadcast at 2 p.m. California. Probably all should know about that. Hope you can dial into it.
Yeah, I sent that out to the district. Yeah.
So how is your district before let's see, I have
Well,
1
we
minute.
got a minute. We might want to catch up afterwards.
I was gonna ask you guys, how are you doing for your 20% DDF for the World Polio Fund?
We don't do, that's another topic, Mike. We're
Excellent.
pretty much committed that to our grants.
Right.
But we
Okay.
we can talk offline about that one.
And with, yeah, I understand.
Okay, all right. Well, we're here at 7:30 in the morning and welcome everyone. We're excited to have you here. I'm Beth Garrow. I'm the district's PolioPlus chair. And with me today, I have two of our End Polio Now zone coordinators. And admit people as we come in. Dr. Marnie Uhlberg and Mike Crosby. And you want me to start over? We're okay. So with me today, we're very happy that we'll be hearing from two very seasoned folks who've done a lot in their own way with polio. Dr. Marnie is with the Rotary Club of Wheat Ridge, Colorado, in District 5450. And she also is a semi-retired family medicine physician who founded a post-polio clinic in Denver in 1985 and continues to work and consult with polio survivors. She's served and continues to serve on the board of directors for Colorado Post-Polio Organization and Post-Polio Health International. She's founder of the Human Gait Institute, a nonprofit organization that provides education to potential and current users of leg braces orthotics. Mike Crosby is a member of the Rotary Club of Brentwood, California, in District 5160. He is past club president, Rotarian of the Year, and past assistant governor. In 2022, Rotary International selected Mike as one of 40 regional members worldwide who went above and beyond in polio. He and his wife traveled to a part of India where they vaccinated children for polio and other diseases. And they've later gone on to Uganda, where they delivered 265 wheelchairs to polio survivors and others in need. So we're really grateful to have you both with us. And with that, I'm going to turn this over. I'm going to ask everyone to mute, if they would please, and save your questions for the end. And I'm going to turn it over to Mike. And thank you.
You're welcome and good morning, everyone. We're so glad to be here. Marnie and I are absolutely thrilled at being able to share some information with you. I'm going to get this program going, and here we go. So I want to apologize, Marnie, that I didn't put your name up here because until just this morning, I didn't think you'd be with us. So what we're going to do today, Beth and I have talked, and we understand you'd like to understand more about what we're doing. I would say the image that you see in the bottom left corner talks about the longest marathon run that anyone's ever run, and that is ending polio. It really started in 1979, accelerated and became official in 1988. However, in 1985, Rotary adopted the phrase PolioPlus. We've heard it so much. What does it really mean, and how critical is it to understanding what polio does? Because the bottom line, fellow Rotarians, is that when we go in anywhere in the world to help end polio, what we're doing is really, really much bigger than just polio. Quite frequently, we get people who come in remote areas and they say, that's all you ever do. So we come back, and Marnie, what do we typically bring? And Marnie, if you just unmute yourself, then you can just jump in with my suggestion. When we typically go into somewhere, what do we typically do in addition to just vaccinating for polio?
Well, certainly education about health issues, depending on the circumstances. We were very involved with COVID. Also, the laboratory ability to detect poliovirus in people who are paralyzed, but also in environmental samples. And that was useful to help control Ebola in Africa, in addition to the polio. Frequently, we give vitamin A drops. In fact, they're doing that in Gaza, along with the polio drops. And that can make a real difference in children's immunity. And I'll stop there.
Right. That's good. Yeah. And so we want to talk to you. In fact, I'm going to back this up just one slide. Okay, here we go. What's really important to understand is when the Rotary Board of Trustees created these 7 areas of focus, they created things that would have global impact and appeal. And quite frankly, when Marnie and I talk to groups, they want us to come in and talk about what? Disease prevention and treatment. And oh yes, water and sanitation. But when you look at all 7 of these areas, the PolioPlus Fund absolutely contributes to these areas. Now, I'd like to introduce you to this gentleman, Muhammad Ali. He is from Nigeria. He has had polio his entire life, and he raises goats, sells the milk, sells the goats. But he has a problem, and he had a problem once he decided to do this. He needed to pay someone to go and get the feed for the animals. So Muhammad applied to Rotary for a very, very small international polio grant. He was given a handheld tricycle with a basket on the back. So now Muhammad can go to the market himself, doesn't have to pay anyone, bring the food back for his animals, and he is experiencing financial benefit from helping by Rotary. Now, we're part of the Global Polio Eradication Initiative. These are the key members. You've probably heard of these. I'm sure Beth has told you. We're going to talk later on about the two that you see circled here and why they're so critical even in today's world. We, Rotary, make no mistake about it. We are the heart and soul of ending polio. We, as Marty mentioned, we are active in supporting the vaccinations in Gaza. So what is the Global Polio Eradication Initiative? Again, you see those two areas in the bottom, which are Afghanistan and Pakistan. But look at the depth and the breadth of what GPEI does. Every one of those 41 countries has experienced some form of polio. Variant is one that we'll have Marnie describe. In fact, Marnie, this might be a good time right now. How is polio a variant of polio? What is that? How is that different than polio we're seeing in Afghanistan and Pakistan?
So variant polioviruses is a relatively new term for what used to be described as circulating vaccine-derived polioviruses. The name is a little confusing. The vaccine-derived is a little confusing in that sometimes, and it's been used against us by anti-vaxxers, but it is medically correct. It's derived from the polio virus that's in the oral polio vaccine, but not directly. When oral polio vaccine is given in countries with low rates of immunized or people or only partially immunized, then the virus is excreted in the stools of those people for about 6 weeks. And in countries where there's poor sanitation and lack of access to clean water, after about 10 cycles through this out into the environment and back, it can mutate to a form that causes paralysis.
And so it's a huge challenge because even though somebody might have been vaccinated, Marnie, they can travel to any one of these countries and included any place in the world, and they can bring that virus to that community. And the enemies for these areas are a lack of clean water and also a lack of vaccination. So what I want to do right now is I want to share with you something. Beth, you asked us to talk about Rotary and how long have we been involved and what's been the difference? I'm going to take you back to 1955. Look at the world in 1955. The significance of this map is that every single country that you see here is a representation of what's going on in Afghanistan and Pakistan right now. Polio ran wild. Polio ran wild. Now, get ready. Hold on to your bootstraps because this is going to go fast. I'm going to take you forward to right now. Oh, did you catch it? In 1988, when Rotary really first got involved in this, there were 125 countries still where polio was running wild. And what difference did that make? We're going to look into that right now. But before we do that, I know for those of you that are on the call right now, this is a really quick test. What we want you to do, I can't see all of you, and I hope you can see us. Take a hand, any hand, and reach over and touch an ear, okay? Beth, would you do that so I can, oh, good, I can see that. Marty and I are doing it. Neil, okay, can put it down. Congratulations. What's the significance of that? when you're in the field, we know that you are at least 5 years old. Now, what's the big deal about that? Under 5, typically, the child's head is bigger and the arm is shorter, and they just can't reach all the way over. Okay, it just doesn't happen. But with that in mind, listen and watch the most amazing depiction of the challenge that we and the world faces in trying to find those children.
There are 678,290,000-ish children under 5 around the world. But what's so important about being 5? A lot, it turns out. Children who survive to age 5 are twice as likely to reach adulthood. That's why vaccines for young children matter so much. In the last 40 years, global public health infrastructure has reached children here, and here, and even here. Impressive, right? But 12.5 million children in the world are still totally unvaccinated. They're called zero-dose children. Some of these kids are hard to reach because they're living in conflict zones or remote villages. But some aren't that far away, living in dense, low-income urban centres. Essentially, they could be anywhere. Can we really find them? Absolutely. India proved it could be done. In 2009, nearly a third of Indian children under 2 years old were zero-dose children. That year alone, there were 741 reported cases of polio, more than any other country in the world. But with just 1 year of vaccination campaigns that included special strategies to reach zero-dose children, they reduced that number to 42 cases. But how? Well, in some places, vaccinators look for families at bus and train stations. Others use motorbikes or trek by foot to find children in the most remote regions. And to tackle 107 city blocks identified as high risk, vaccinators travelled house to house, delivering immunisations for polio and other preventable diseases. Doing this required 4 million vaccine carriers, 5 million vaccinators, 344 million children vaccinated, and 450 million doses of polio vaccine. See? It can be done, and the results are worth it. Let's make sure all children grow up healthy and vaccinated against preventable diseases, and ensure that zero-dose children are a thing of the past.
A couple of key things I want you to think about. As you watch that video, you saw a man throw a bucket in water. That is how we detect, typically, as a representation, polio in an area. As Marnie mentioned, we help fund 146 labs around the world. Their job is to do exactly that. And during COVID, they were doing the same thing. So Rotary, along with UNICEF and our other one of our other partners, WHO, has helped produce with the government of Pakistan a series of videos that help them understand the challenges of not vaccinating. And why would they do that? Because in Pakistan, the literacy rate is 59%. And that's for men, because the challenges that are faced often do not provide access to becoming the ability to learn. Our numbers for Afghanistan are 10 years old, but we believe it's around 39%. So you're going to see a video right now, which the Pakistan government has said, this is how we're going to share the message to vaccinate with everyone. This particular one focuses in general on why it's necessary to understand that the testing that's going on in local communities.
अगर आपके इलाके के माहौलियाती नमूने में पोलियो वायरस मौजूद है तो वहां का हर एक बच्चा न सिर्फ इस खतरनाक बीमारी का शिकार हो सकता है बल्कि एक बच्चे से दूसरे बच्चे तक ये वायरस मुंतकिल भी हो सकता है। याद रखिए, पोलियो का कोई इलाज नहीं और नतीजा जिंदगी भर की मासूरी। इसलिए आप सबसे एक गुजारिश है कि पोलियो वायरस चाहे शहर हो या गांव, आपके बच्चों को निशाना बना सकता है, उन्हें पूरी जिंदगी के लिए मासूर कर सकता है। लिहाजा जब भी पोलियो टीम आपका दरवाजा खटखटाए, अपने 5 साल तक के बच्चों को पोलियो के कतरे लाजमी पिलवाएं। इन्हें अपने पैरों पर खड़ा रखने की जिम्मेदारी निभाएं। इसलिए फैसला आज करना है, अगर कल बच्चे को चलना है।
Typically, when these videos are shown in the bottom left-hand corner, a mullah religious leader will also come in and talk about why it's so necessary. So this is a big operation, folks. The key to ending polio is multifaceted. At the biggest and the most expensive part of this is just finding them. But when we do find them, in parts of the world, men are not allowed into the home to vaccinate the children. So the role of the woman is critical. They're typically between 20 and 31 years of age. They are educated themselves. They go in, they gain the trust of the mother, they teach them, they educate them, and at the same time, there are guards there that are protect them. Because it's not an easy job to be in. They are challenged, they're spit upon, beat upon, and we've had over 70 guards that have been killed in the process of trying to protect them. Why? Because this vaccination effort is something that is supported by the government of the country, Afghanistan and Pakistan, and those who are trying to take down the government want to deal with that. So that's a problem, obviously, that needs to be dealt with. Now, right now, this is where we stand financially in terms of the things that we count the most, and that is cash and DDF. And DDF is critical because it also has a 50-cent development on that. Now, these numbers are year to date right now, looking back at the same period in the prior years. You might wonder, why was it so much higher back in 2021? That's when we were giving $1 to every $1 of DDF given. It's now down to 50 cents. Where are we today? These are scary numbers, folks, but there's so much that we're doing that is even better. This represents Afghanistan and Pakistan. Every one of those red dots symbolically show the 56 typically children who are unfortunately have paralytic polio. A bigger look. Every one of these dots, once again, is a paralytic polio case. The variant that Marnie described is shown here, and throughout the world you can see why this representation shows those 42 countries who are actively involved. There is good news, though. This same time period last year, we had 528, and right now we're down to 181. And you could get discouraged at the number that you just saw a moment ago. But I want to take a quick look at this and see the progress that's actually been made. Look at 2020, where we were at. Look at the numbers. 1,253 polio cases. Right now we're down to 233. There's a huge challenge here in Afghanistan and Pakistan. We can talk more about that later on, but basically what you have to see right now is that the two countries don't trust each other. There is a border line of almost 1,700 miles, and there are only 8 checkpoints across those areas. We Rotary and we, the Global Polio Eradication Initiative, are there 7/24 at every one of these borders, and we're vaccinating anybody as they go back and forth. The things you see on the side in the big red box, those are the issues we're facing there as well. Now, I'm going to, if there's time at the end, I'll skip over this video, which I love. It shows going into the field and trying to understand from a reporter standpoint why people are reluctant to be vaccinated. And if we have time, we'll come back to that. So Gaza, okay? These are the facts. Marnie knows me, I typically don't like death by PowerPoint with all these words, but I think it's really important. I know you can all read. They're here. I'm going to be quiet for about 5 seconds. That's hard for me to do, and let you look at those and you can understand what we see here. Now, Marty has told you that we need 2 doses, okay? That should get the child up to about 80%. 3 would give them 90%. But the good news is we just finished the second round where we're back again. And what I love to see at the bottom of this is no one's been injured through this. Can you imagine the challenges that's being faced? Now, Afghanistan, that's a different situation. And we are quite serious and worried about the situation in Afghanistan right now. The leader of the country has declared that 2 things. Number one, that we cannot go into homes to vaccinate. Number 2, that women cannot speak when they are outside of their homes. Those are significant challenges, obviously, to the situation that's going on. What can you do? All right. It's pretty simple, but it's not. We need to help people understand what our communities are doing, what we are doing as Rotary. We need to belong and be a part of the PolioPlus Society, every one of us. Beth, I know you're working very hard at that. It's so important. And if you can't find the financial means to do $100 a year or $10 a month to join, go to Rotary Direct and give anything, because every single dollar counts. And what does that mean? It means that there are different options as well, and that is Molly. Now, you don't know Molly, but this is a real dog that is a major donor. $10,000 in cash. You have the opportunity, if you have a pet, to have them join the Kennel Club, which is an extension of the PolioPlus Society. Again, Beth can give you more information on that. Where does that money go? It costs about $3 to vaccinate a child. When you join the PolioPlus Society, you're giving $10 a month, $100 a year. That's doubled by the Gates Foundation. That becomes $300. So you know that you have the ability to save 100 children in this world from polio. On top of that, every dollar you give to the PolioPlus Fund counts equally towards your Paul Harris recognition. So it's a double whammy. So if there's anybody on the call right now who wants to join the PolioPlus Society and give $1,000 a year, that automatically qualifies you for the Paul Harris Society. So you've asked to know, where are we going? What are we doing? Right now, the Global Polio Eradication Initiative has said that we believe by the end of, we are hopeful, we are working at ending world polio by 2025 and giving a 2-year window to look toward the end. We're also, the variant polio, we think that's going to take longer and we need to be more vigilant. What's going on next? There are meetings occurring right now in the world talking about the future investment funding when we do reach that point. World Polio Day is now this week. And I want to leave you with this final message so we just can make sure we get some questions in, Beth. And this is Bill Gates. We know who he is. We understand. But what does Bill Gates think about Rotary?
A century ago, around the same time Rotary was starting to grow into the global institution it is today, polio was one of the most feared diseases in the world. Today, we're close to ending it for good. The tough fact is, as long as polio exists anywhere, it's a threat to spread back everywhere. The world owes a debt of gratitude to the Rotarians, healthcare workers, and volunteers who've knocked on doors, set up clinics, and traveled across countries to make sure children are protected from this awful disease. We should all be incredibly proud of how far we've come. When polio is eradicated, and I do mean when, not if, it will be.
Somehow that ended too quickly. He's going to tell you that, in fact, when it ends, it will be indeed our gift to the children of the world, because that's what we're doing, fellow Rotarians. That's why what we're doing is so, so significant. Together, fellow Rotarians, we will end polio. I'm going to take this off the screen right now. and open this up to questions to both Marnie and me. And any medical questions, you can shoot Marnie's way. Any woohoo things, you can go to me. Go ahead, Beth. And
Thank you both so much. That was very comprehensive. You know, I give a number of updates too to the district, but it's constantly changing, and just the reminder of why it's so important, and why we're still at it. Yeah, makes a huge impact on people, and especially the newer generation that really isn't familiar with polio. So both your expertise is tremendous, and we appreciate it very much. Do you know if I understand there were two ceasefires in Gaza, correct? To enable us to do the immunizations. Do you know if the second one is done now? Is that?
Yes, it just completed. It started on the 14th, I believe, 14th of October. Each one of them are 3 days. There's a third one scheduled. There's still that number that you saw is we're still going after relatively that same number, around 600,000 children.
That's great. Thank you. David or Neil, do you have any, or
Yeah.
Corey? Yeah.
You might have mentioned this, but how many doses per year are required worldwide in order to reach this goal of ending polio in 2025 or 2026?
Marnie, go ahead.
Well, it depends on, I mean, obviously there's new children being born every year, so it definitely includes those, which is, I mean, numbers in the millions, probably close to 1 billion. And each of those children need preferably 3 doses. Some of the children, like, they go back and forth across the border between Afghanistan and Pakistan and get immunized every time they're going through. They're going to get multiple doses, but you know, multiple doses doesn't hurt.
Mm-hmm.
It just it's better to do multiple doses than to miss some children.
Sure.
Yeah, as a good example of this challenge of that number, in India, country of 1.3 billion, every month there are 100 million new babies. Every month. They all have to be vaccinated, right?
Yes. So follow up, how many doses with the current resources and staff and volunteers is it possible to administer in 2025? Potentially. Just a estimate.
Well, last year we vaccinated 400 million children.
Okay.
That's globally, okay? And that's not just there. You saw the 42 countries where we're focused on, right?
Mm-hmm.
Vaccinations occur. India was not one of those 42, but we're still vaccinating there. We're vaccinating in Mexico. We're vaccinating around the world, 400 million.
Amazing.
Now, those are with the oral drops. We're talking about that the oral drop that we see, and they come in a very small vial, okay? That is what we're using. We're not talking about the injection. We stopped doing drops in our country, Marnie, I believe in the year 2000.
Correct.
Yeah, and so that's effective as well. The overall plan of the Global Polio Eradication Initiative, the strategic plan calls for the end of the drops at some point. The challenge is, my wife and I went to Mexico. To India. We vaccinated children. We're not doctors. Anybody can put the drops in the mouth, but giving the injection is a whole different ballgame.
I'm going to have to interject. I'm sorry to do this because I'd love to keep this going, but this cuts off like right about now. And we have recorded this, and what we're finding with these chats is that we get lots and lots of folks that tune in after the recording. So I just want you to know that this is going to get disseminated out to lots of our Rotarians in 5340. So we're very, very grateful for all your time, and we thank you. And Don, did you want to, past District Governor Don, add anything? This is really good. Thank you.
No, I appreciate your time to make these comments about the End Polio Now program and just the tremendous amount of work that it takes to eradicate this disease off this planet.
The
Thank you.
council, just have to close this. The council on legislation has once again affirmed that ending polio remains the top humanitarian priority for Rotary, folks. Not just let's maybe do this. We are going to be there till it ends, and we can't do it without each other. Thank you. Thank you, District
Thank
Governor.
you.
Thank you both. Appreciate it so much. All
Thank-
right.
Bye.
All right. Thank you. Bye-bye. Thank you, Marnie and Mike. Appreciate it very much.
Oh, you're welcome.
Yeah, we do. That was a great presentation. That was terrific.
Well, it's so hard in 20 minutes to the things.
I know. But it's just
Yeah.
getting this out is just even better. So you know, we have it. I'm doing a presentation on Wednesday and I'm doing another so I just get out there, and then we're having our foundation district foundation meeting, and so I'll probably use some of this material as well.
But it is interesting you mentioned that. I'm speaking tomorrow night via Zoom to another district who has all of their foundation chairs on a Zoom.